Hi, I'm Dr. Fredrick Echols, Health Commissioner for the City of St. Louis. The Pfizer COVID-19 vaccine has been approved for children 5 to 11 years of age and is now available in the City of St. Louis. This week, the Department of Health received several questions related to myths and misinformation about the COVID-19 vaccine for children ages 5 to 11. It can be difficult to know which sources of information you can trust. Obtaining clear and accurate science-based information about COVID-19 vaccines is essential to making good decisions about the vaccines and protecting your health, the health of your family, and the health of your community. Before acting on information, especially information from internet sources, verify that it is from a credible source and check for updates on it on a regular basis. Your healthcare provider and the City of St. Louis Department of Health are great sources for accurate, science-based information. If you have questions, please email your questions to health@stlewis-mo.gov or call our COVID-19 hotline at 314-657-1499. Emma from zip code 63116 asked, was there enough time provided to review the vaccine? I read the process was rushed. All the COVID-19 vaccines authorized for use in the United States have undergone and will continue to undergo intensive monitoring to ensure they are safe and effective. Clinical trials in children ages 5 to 11 years found the vaccine to be 90.7% effective in preventing symptomatic COVID-19 disease. Safety data from the trials, which included more than 3,000 children who received the vaccine, found the most common reactions were pain at the injection site, fatigue, and headache. Reactions were mostly mild or moderate. There were no serious adverse events related to the vaccine. If your child has underlying medical conditions or you have questions on how the vaccine may impact your child, please do not hesitate to send your questions to your child's medical provider. Mason from zip code 63115 asked, why do children need to get the COVID-19 vaccine since they don't get COVID-19? The American Academy of Pediatrics has reported that federal data shows that since the start of the COVID-19 pandemic, about 1.9 million children ages 5 to 11 years have been infected with SARS-CoV-2, the virus that causes COVID-19. The data shows that more than 8,300 children have been hospitalized and 94 have died. We cannot ignore the data. More than 1.9 million infections, 8,300 hospitalizations, and 94 deaths make it clear the vaccine is needed. The vaccine not only offers protection to children from getting sick, it can also help protect others as well. When young people get vaccinated, they reduce their risk of getting COVID-19, spreading it to loved ones and the rest of the community. In addition, getting the vaccine has other benefits, such as ensuring students can remain in school for in-person learning without interruption. At this time, students who are not fully vaccinated must quarantine if they are a close contact to a COVID-positive person. When students are out of school, we know this impacts the entire household, so it also impacts the financial well-being of families. Regina from zip code 63107 asked, isn't it true that components of the virus have been added to the vaccine? The COVID-19 vaccine currently being offered in the United States does not use the live virus that causes COVID-19. The vaccine will protect your child, not infect them. The Pfizer-BioNTech COVID-19 vaccine contains messenger RNA, mRNA, which is genetic material. The vaccine contains a synthetic piece of mRNA that instructs cells in the body to make a distinctive spike protein of the SARS-CoV-2 virus. This helps ensure your body can identify the virus and respond efficiently and effectively if you're exposed and get infected. Mia from zip code 63103 asked, since 5 to 11-year-olds are being vaccinated, will we still have to wear masks? Even though the vaccine is now available for those 5 to 11, until vaccination levels increase, we will still need to continue practicing those mitigation measures we've been using, such as wearing a face covering when indoors around persons not in your household, social distancing, and having events outdoors, all things that we know can prevent the spread of the virus. We must also remain mindful of persons in our community who are not able to receive a COVID-19 vaccine because of contraindication. We all have a responsibility to show compassion for others. One way we can do that is by continuing to implement those simple but effective prevention measures. Thank you for tuning in this week, and thank you to Emma, Mason, Regina, and Mia for submitting questions. Please be sure to tune in next week for more critical public health information. I really want to hear from you, St. Louis. Please send your questions to health@stlouis-mo.gov. Questions will be answered in the order they are received. If I run out of time on air, your question will be answered by return email. Be well, St. Louis.